everybody. Welcome back to the Little Brain Campaign. I am your host, Dr. Lauren LaRose. I am a board-certified child and adolescent psychiatrist and adult psychiatrist. And in this podcast, I usually like to talk to experts from various fields related to mental health and physical health of kids and their caregivers. But today, I am going to do something a little different. I recently recorded with Kirk Martin from Calm Parenting Podcast, and he encouraged me to try doing some episodes on my own. So that is what I'm going to do today. If you're watching me on YouTube, you probably noticed that I'm recording somewhere different. I usually record in my kitchen, which is being gutted right now. So I am currently in the kids' playroom. So you get to see what my kids play with. Today, I'm going to talk about something that people who have been listening for a while know is near and dear to my heart. This is a condition called PANS. There is a version of it called PANDAS. So often you'll hear people say PANS and PANDAS together. PANS is Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS is Pediatric Autoimmune Neuropsychiatric Disorders associated with streptococcal infections. So PANDAS is a subset of PANS. And the reason why this subject is really near and dear to my heart is because one of my children was diagnosed with PANS in July of 2024. So it's been a little over a year and a half now. So what is PANS and PANDAS? So PANS is characterized by a quote unquote sudden onset of obsessive compulsive symptoms or eating restrictions. And that is often accompanied by symptoms like anxiety, sensory or motor abnormalities, behavioral issues, a deterioration in school performance, mood disorder, urinary symptoms, and sleep symptoms. So PANS can be caused by several different things. It can be caused by bacterial infections. It can be caused by viral infections. It can be caused by parasitic infections. It also can be caused by exposures to toxic things like mold. PANDAS, which is a subset of PANS, is caused by strep infections. So PANDAS was what was originally described. And then they realized that this syndrome, these symptoms can be caused by things other than streptococcal infections. So basically, PANS or PANDAS is a type of autoimmune encephalitis. So what does that mean? Encephalitis is inflammation in the brain, and autoimmune just means that it's immune mediated. Okay, so there's some kind of infection or exposure to something toxic, and the child's body, instead of attacking that infection or that toxin, starts attacking a part of their brain called the basal ganglia. Okay, so what is the basal ganglia? So the basal ganglia is a structure that's really deep in the brain, and it's responsible for motor control, voluntary motor control. Okay, so voluntary physical movements, but it's also responsible for things related to emotions, cognition, reward processing. So it serves a lot of different functions. And when things go haywire in the basal ganglia, it can cause a lot of problems. This is something that we have seen in other disorders. So this is not specific to PANS and PANDAS. Okay. There is something called Sydenham chorea, which was identified a long time ago, and is accepted in the medical community as a legitimate condition. So this is an autoimmune neurological condition that is caused by a strep infection. Okay. And again, the antibodies, the immune system, instead of attacking the strep infection, starts attacking the basal ganglia. And this causes these classic involuntary rapid jerky movements in the face, the hands, and the trunk. But it also can cause some neuropsychiatric symptoms like emotional instability, anxiety, and OCD symptoms. So we know and we accept in the medical community that this can happen. There can be an infection, the immune system starts attacking, the basal ganglia instead of attacking the infection. So there's a immune dysfunction or dysregulation. There's also some other types of autoimmune encephalitis, like anti-NMDA receptor autoimmune encephalitis. That's a mouthful, but a lot of you have actually probably heard of it. If you've read Brain on Fire by Susanna Cahalan, or if you've seen the movie on Netflix, that is about her own experience with having anti-NMDA receptor autoimmune encephalitis. And I will say this is something that I saw a few times when I was in residency. We had some patients in the hospital that we were consulted on who tested negative for everything under the sun, and they had these really significant psychiatric symptoms. And it turned out that they had this anti-NMDA receptor autoimmune encephalitis. So, we accept in the medical community that this is a process that can happen and does happen. But for some reason, we have had trouble accepting that this can happen in the context of PANS and PANDAS. There's been a lot of confusion and doubt in the medical community about these conditions, which really does not help patients or families. So my hope is that I can maybe be a little part of spreading awareness. This episode is really for people who are unfamiliar with this topic. And I'm sorry if you're hearing banging, they're tearing my kitchen apart downstairs. But this episode is really for people who are not very familiar with this topic and want to learn more. Maybe you have a friend whose child has this condition, a niece or nephew, or if you are a medical or mental health provider that is just starting to hear about this or learn about this. If you're looking for a really deep dive on PANS and PANDAS, this is probably not the place for you, but there are some great podcasts out there that I listen to a lot. One is called Demystifying PANS and PANDAS, and that is a podcast by a doctor named Dr. Nancy O'Hara. She is probably the leading expert in the world for PANS and PANDAS, and she is so informative. So I highly, highly recommend her podcast. The other podcast that I think is really helpful is called Untangling PANDAS and PANS, and that is by a woman, Susan Manfill, whose daughter Alex died secondary to PANDAS as a young adult. Those two podcasts have a much more in-depth and detailed explanation of what happens in PANS and PANDAS, all kinds of complications, and they talk to experts in this field. So if you need something more technical, please go there. If you're a parent of a kid who has PANS and PANDAS and you're looking for a little bit more of the emotional support, I really like Eileen Devine. She was on my podcast not long ago, if you can remember. She has a great podcast that's very validating. It's called Brain First Parenting. There's also a podcast called The Calm Parenting Podcast by Kirk Martin. He was also on my podcast not long ago. So he's a great resource if you need a little help on the emotional side of things or on the parenting side of things. Okay, so just to hop back to this condition and how does it happen? Okay, so there's a process called molecular mimicry. So basically, your immune system recognizes that there's certain proteins in this this infection, this bug that's in your body. Okay, and these proteins may look similar to ones that are in a certain part of your brain, that basal ganglia. Okay. And so the immune system basically gets confused. All right. So it thinks it's attacking the infection, but really it's attacking this part of the brain. Okay. Now, when providers who treat PANS and PANDAS, when they take a history, they're always going to do a family medical history because the vast majority of these kids have some kind of family history of autoimmune disease. And it does tend to be more frequent in mothers. Okay. I think that Hashimoto's, which is autoimmune hypothyroidism, is, from what I heard, is the most common autoimmune disease that we see in the family history. That's probably because it's a very common autoimmune disease. That is what I have. So that is my child's predisposition, but we also have some autoimmune diseases in our family in general, like scleroderma, Crest syndrome. So, these kids are going to have some kind of family history of autoimmune disease. And like we've said before in different episodes, the genetics load the gun, the environment pulls the trigger. So the genetics are predisposing the child to an autoimmune disease. And then the environment, which is their exposure to whatever infectious agent it is pulling that trigger. It's causing the expression of the disease. So what does diagnosis look like, the diagnostic process for this? So this is a clinical diagnosis, which means that it is diagnosed based on history and presentation. Okay, so history and symptoms. There are some lab values that can help to support the diagnosis, but they're not necessary for the diagnosis. So usually these kids will get some kind of lab workup, okay, blood work, which includes antibody markers for certain conditions that would commonly cause PANS and PANDAS. Okay, so obviously we're going to look at strep antibodies, okay, but there's a lot of other antibodies that are important to look at. Mycoplasma, which is generally the cause of walking pneumonia, okay, and just so you know, since it's called walking pneumonia, a lot of people don't ever realize they have it, okay, because they're still functional. Epstein-Barr, flu, COVID, herpes viruses, just to name a few, okay? There's also a lot of talk about tick-borne or vector-borne illnesses. So I think most of us learned that these are diseases of the Northeast and the Midwest, maybe. And experts in tick-borne or vector-borne illnesses are really stressing that these diseases can happen in every single state in the US. And yes, they happen outside of the US too. Okay, so just because you live in the South like I do, it does not make you immune to tick-borne or vector-borne illnesses. Why do I say vector? Because ticks are kind of what we know about from Lyme disease, okay? But there are a lot of other types of animals or insects that can carry these illnesses. So we think about ticks because one of the most widely known tick-borne illness is called Lyme disease, which is caused by a bacteria called Borrelia burgdorferi. But ticks can carry other bugs, basically other bacteria and parasites. And also, these bugs and parasites can be carried by other quote unquote vectors like lice, fleas, mice, rats, cats. Okay, so it doesn't have to be a tick bite. This is something that I've had to become very familiar with recently. And I'm just going to share personal experience because I think that this helps people to understand how common these conditions are, and we just are totally unaware. I went to a conference in October that was really meant to help me with my practice, help me learn how to treat my patients better, but I ended up learning a lot about my own child because about half of the lectures were on PANS and PANDAS. And there were several lectures on tick-borne illnesses. Like I said, those experts kept reiterating that these tick-borne illnesses can be found and diagnosed in any state in the United States. I was not totally familiar with that concept before this conference. I really did think of this as a Northeastern problem. They described some tick-borne illnesses that sounded really, really familiar to me, specifically one called Bartonella. The symptoms sounded a lot like what my son experiences. So I just kind of logged that in the back of my brain. And when I got home from the conference that week, a patient of mine came in who had been diagnosed with PANS a while ago. And the mom said that he had recently tested positive for Bartonella. And it was a strange coincidence. And so I logged that in my brain too. And the more and more I did research about it, the more I thought, I wonder if this is a possibility for my child, because it seems like we have made a lot of progress, but there are still some things that aren't quite where they should be with his mental health. And so I talked to his PANS provider, and we agreed that it wouldn't hurt to do the testing. If it's negative, it gives us peace of mind. If it's positive, then we have a new target to work on. So we did the tick-borne illness testing, and lo and behold, he was positive for Bartonella, but he was also positive for something called Babesia, which is a parasite. And just, I think that these tests are, the reliability is questionable a lot of labs. And so it's hard to find a lab that does good testing. I will say, though, that he didn't just have antibodies, on a blood smear under a microscope. He actually had the organisms. So, can't really deny that. So it just showed me that we are probably missing so much with these kids. We are probably missing co-infections. We're probably missing these in the general population. I think especially in the psychiatric population, especially in areas where we're not really thinking about these kinds of things. In Southeast Louisiana, we are definitely not thinking about ticks or vector-borne illnesses. That is not on our radar. And Dr. Rosalie Greenberg, who did an episode recently with me, who is a psychiatrist in the Northeast, said that once she tested the majority of her patients in her practice, where she treats pediatric bipolar disorder, she found that the vast majority of them were positive for tick-borne illnesses. And so she is now rethinking all of these patients that she's been treating for decades, that she assumed just had pediatric bipolar disorder, and realizing that a lot of them probably have and had tick-borne illnesses causing these symptoms. And once she treated for those, these patients finally got better when they had suffered for so long, but on so many psychiatric medicines in psychiatric hospitals. So, the treatment with the antibiotics or antivirals or antiparasitics, anti-inflammatories, i.e. ibuprofen, that's really just the tip of the iceberg. That's the starting point. I will say that I have I've become a magnet for these patients in my community. So I will tell parents a lot of the time, if I think it kind of sounds like PANS and PANDAS, but maybe they're on the fence, I'll tell them, give your kid ibuprofen twice a day for a week and let me know how they look. And if they notice a significant improvement in the symptoms, that tells me, okay, well, this is neuroinflammation. ADHD and oppositional defiant disorder and OCD don't get better with ibuprofen, but neuroinflammation does. So that can kind of be the litmus test. But there's so much more that goes into treating these kids. A lot of it is focused on just reducing overall inflammation in their body. And how do we do that? We work on their gut health. We reduce exposure to things that can increase their inflammation. So processed foods, food dyes, maybe food allergens that we didn't know that they had, environmental toxins. We have to improve their body's ability to filter out these things. Okay, so part of that, again, is working on their gut, making sure that they're excreting things healthily. There's also a lot that has to do with their airway and their nasal filtration. Another personal story, I feel like I have to tell these just to help people, because I think we don't realize how common these things are. You've probably all heard Dr. Levy on my podcast before, and if you haven't, please go back and listen to her episodes. She recorded 3 separate episodes with me, all about sleep apnea and TMJ. And I stumbled upon her because of a mutual patient, actually. But, once we started talking about my kids, realized that I probably needed to get them evaluated. And I was actually more concerned about my child that does not have PANS and PANDAS in his tongue tie and chronic nasal congestion. So I just took both kids to see her. She did an exam. She was definitely concerned about the way that their mouths have developed. And so she sent them for an in-house sleep study. So we went to a sleep medicine clinic and stayed the night. And both of my kids on sleep study had sleep apnea, which was shocking to me because I have never heard my children snore, ever. I have never heard them snore. They go to bed at night. They go in their room. I don't see them until the morning. I never had concerns about sleep apnea, ever. They really don't have any of the classic symptoms that I knew about. Now, they do have some symptoms that I didn't realize were symptoms of sleep apnea. So again, if you want to hear about that, go back to one of Dr. Levy's podcast episodes from a few months back. So, you have to make sure that the kid is breathing properly, okay, and filtering out things through their nose, because, if they're not breathing properly while they're sleeping and their mouth is hanging open, mouth breather, they're losing that first level of protection against things coming into their body. Okay. Also, if you're not breathing properly, that's going to increase overall inflammation in your body. Another part of treating these kids is addressing their autonomic nervous system. So I've talked a little bit about this on different episodes, but your autonomic nervous system is the part of your nervous system that controls the most basic functions of your body. Your breathing, your heart rate, your blood pressure, your GI motility. And we want to be in a balanced state with our autonomic nervous system. So we want to be able to spend a good amount of our time in what's called parasympathetic mode, or rest and digest. Okay, so that's when your body's doing all of its basic functions. But we also want our autonomic nervous system to be able to go into sympathetic tone, or fight or flight mode, when it needs to. So if we are being chased by someone, or if there is a real threat in front of us, or we step into the street and a car is about to hit us, we want our autonomic nervous system to be able to switch into our fight or flight mode to protect us, to keep us alive. Okay. The problem is when our autonomic nervous system gets stuck in that sympathetic tone. So it gets stuck in the fight or flight mode, and it's not bouncing back to the parasympathetic mode, okay, or bouncing back to at least be balanced or relaxed. So a lot of these kids get stuck in the sympathetic tone, that fight or flight mode, because if you think about it, their body is constantly fighting something. It's constantly fighting itself, honestly. It's constantly attacking the brain. So the body doesn't ever get to rest and digest properly. Okay. And so what does it look like when kids are stuck in this sympathetic tone? They can be very jumpy, very irritable, very edgy. I know, for my child now, looking back, I'm recognizing a lot of these symptoms. I didn't know what they were at the time, but I remember a teacher telling me when he was in pre-K that when something would happen and she would try to hug him, he just was frozen. He was like frozen and rigid, like he didn't know how to accept a hug. And I think he just was so stuck in that sympathetic tone. He also had a really poor heart rate variability, which can be a sign of sympathetic overdrive. Okay, basically your heart is not responding as it should to changes in your activity level. Okay, we want our heart rate variability to be high. So we want our heart rate to be able to change in response to what we're doing and what's going on in our environment. And when heart rate variability is low, that can be a sign that we're stuck in sympathetic mode. We can also see it if people are stuck in parasympathetic mode too much, and then they basically are chronically fatigued or depressed. But for a lot of these kids, they might be stuck in sympathetic tone. Okay. So that is something that takes a little bit more work to address. There are some medications that can help with that sympathetic overdrive. But a lot of it comes with just like calming down everything else in their body and getting their body working again more synchronously. What can be done at home and school? There's definitely accommodations that are really helpful at home and at school. If a school is willing to accommodate and they have some awareness about these conditions. Unfortunately, not every school does. So it does fall on the parents a lot of the time to provide education and awareness for schools or try to direct them to resources where they can learn about it. But these accommodations can be really helpful because these kids do struggle with symptoms that you would see in ADHD or oppositional defiant disorder or OCD or generalized anxiety disorder. And unfortunately, they have all of these symptoms at the same time. Also, these kids are often going to have flares of their condition when they get sick. They may be okay and in remission for a while, and then they get exposed to the flu, COVID, just like every kid does at school. And then they're going to have a big flare and be right back where they were when they started. So having a school that understands that progress is not a straight line, these kids are not going to be stable all the time. And then I think something that's really, really important is getting help for parents of these kids. When I spoke with Eileen Devine recently, in the episode she recorded with me, we talked a lot about how this is, it can be a very isolating condition for parents. Unfortunately, parents are going to come in contact with a lot of people who don't believe them, who don't believe that these conditions are real, which is probably the most demoralizing thing as a parent, because you're saying, this child is in my house. I know it's real. I see it every day. I live with it every day. It's real. How could you say it's not real? But unfortunately, that's the response that these parents will get from a lot of medical providers, from family members, from friends. And that can be very discouraging. So it's so important for parents to find a community of providers, of medical providers, of mental health providers, and of other parents who understand where they're coming from, because this is not something you can do alone. It truly takes a village to raise these kids. Therapy for the parents can also be very, very helpful. Eileen Devine does therapy for parents only. She does not see children individually. So she is coaching parents on how to live with and manage these children in their homes. A lot of these parents have their own chronic illnesses, autoimmune diseases, and living with, a child that has these conditions and all of the hurdles that you face can be really traumatizing. So some of these parents will need trauma therapy too. So I think it's super important for parents to get help for themselves so that they can be their best selves for their kids, because this is a long road and it can be a hard road and it takes a lot of support. So I hope that this was helpful. If you have any questions at all about PANS or PANDAS, please reach out. I'm on my own learning journey with this. I am constantly listening to podcasts and attending lectures and going to conferences to learn about it. So I may not be able to answer your question directly, but I at least hopefully can direct you to a resource where you can get some answers. And I appreciate you listening. And please come back. Please let me know if you like these individual episodes. If there's something specific that you do want to hear about, I am all ears. Thanks for listening. Thank you for tuning in to this episode of the Little Brain Campaign podcast. If you've been enjoying our show, give us a follow on your favorite podcast platform so you never miss an episode. If you know someone else who would enjoy this conversation, please take a minute to share this episode with them and help grow our audience. See you next time.